Gentlemen, if you've reached your 50s and self-pleasure is still part of your life, there's groundbreaking medical evidence about your wellness that demands your attention right now. My name is Dr. Rina Shimizu. For more than 10 years, I've specialized in helping men preserve their intimate wellness and prostate vitality through every stage of life. What I'm revealing today is something the medical establishment rarely addresses with transparency: the profound connection between solo sexual activity in your later decades and your long-term health outcomes. Scientists at one of America's most prestigious medical institutions followed the lives of approximately 32,000 men across nearly 2 decades. Their findings? Astonishing. Those who experienced climax 21 times monthly or more showed their prostate cancer risk dropped by 1/5 when compared to men averaging just 4 to 7 releases each month. A 20% reduction in cancer risk from an activity that's entirely natural and costs absolutely nothing. But this revelation barely scratches the surface. There are essential insights about rhythm, approach, and wellness advantages that every gentleman past 50 must grasp. Knowledge that could safeguard your prostate, enhance your rest, diminish tension, and even preserve your intimate capabilities through the aging process. Before we dive deeper, please show your support by tapping that like button, leave a comment sharing your location, and make sure you're subscribed so you never miss vital wellness information created exclusively for men in your demographic. Now let's explore what you absolutely must understand. Breaking the silence. Let me speak plainly. The overwhelming majority of men beyond 50 harbor questions about self-stimulation, but find themselves too uncomfortable to raise these concerns with their physicians. Is this behavior still appropriate at my stage of life? Am I engaging too frequently or not enough? Does this practice harm me or help me? Here's the truth backed by data. Research indicates that 63% of men over 50 engage in regular self-pleasure. If you're among them, you represent the majority, not some outlier. European studies revealed that between 41 and 65% of men ranging from 60 to 75 years old reported solo sexual activity within the previous 30 days. This represents completely standard behavior that persists throughout the human lifespan. Yet here's what troubles me as a medical professional specializing in this field. Most men remain completely unaware that this natural practice delivers substantial wellness advantages, particularly after reaching 50 when prostate concerns become increasingly critical. Your prostate undergoes enlargement as you accumulate years. By the time you reach 60, approximately half of all men develop prostate enlargement. By 85, that figure climbs to 90%. Prostate malignancies become more prevalent, urinary patterns transform, intimate function undergoes shifts. Throughout all these transitions, consistent climax, whether achieved through partnered intimacy or solo activity, serves a protective function that most men never discover. Today, I'm guiding you through 7 absolutely critical insights every man over 50 must internalize. This information draws from rigorously peer-reviewed scientific literature, and it could dramatically influence your long-term wellness trajectory. Let's get started. Point 1. The prostate shielding phenomenon. This stands as the most significant advantage, and the scientific evidence supporting it is exceptionally robust. The major research initiative I referenced tracked 31,925 men across an 18-year period. These findings appeared in European Urology, among the most respected publications in our medical specialty. Men experiencing climax 21 times monthly or more demonstrated a 20% decrease in prostate cancer incidence compared to those reaching climax just 4 to 7 times each month. This protective benefit remained consistent across various age brackets, though it proved especially pronounced in men exceeding 40 years of age. Australian researchers publishing in BJU International uncovered parallel results. Men averaging between 4.6 and 7 weekly climaxes faced 36% lower odds of receiving a prostate cancer diagnosis before turning 70. The biological mechanism works like this. Consistent ejaculation facilitates the removal of potentially damaging substances from your prostate gland. Your prostate manufactures fluid that combines with reproductive cells. When this fluid remains stationary for prolonged durations, it can transform into an environment conducive to inflammation, infection, and potentially malignant cellular changes. Consider it analogous to flushing a plumbing system. Consistent flow prevents accumulation and maintains optimal operation. Climax additionally alleviates prostate congestion, diminishes inflammatory indicators, and sustains healthy cellular renewal within the gland. I recall a patient, 59 years old with prostate cancer running through his family, understandably anxious about his risk. Following our discussion of this research, he made a commitment to maintaining consistent sexual expression, both with his spouse and independently. 5 years down the line, his PSA measurements remain outstanding, and his prostate examinations reveal no worrisome developments. This doesn't constitute an absolute shield against malignancy, but it represents a meaningful protective element within your personal control. If this information surprises you, please hit that like button immediately. Point 2. The ideal rhythm. Most gentlemen lack any framework for understanding what constitutes healthy or standard frequency. The scientific literature demonstrates that 21 or more climaxes monthly delivers the strongest protective advantages. That translates to roughly 5 occasions weekly. Some weeks may involve more activity, others less, but maintaining that average appears ideal for health optimization. This total encompasses all forms of climax: partnered intimacy, solo stimulation, and even spontaneous nocturnal releases. The cumulative total determines the benefit. For men past 50, especially those without consistent partners, self-pleasure evolves into a crucial wellness maintenance practice. Data reveals that self-stimulation rates remain nearly identical between men in committed relationships and those who are unpartnered. This isn't about substituting solo activity for partner connection. It's about preserving prostate wellness regardless of relationship circumstances. One critical clarification: exceeding this threshold doesn't necessarily amplify benefits. The protective advantages plateau around 21 monthly occurrences. Substantially exceeding that number provides no additional protection and might potentially create other complications we'll address shortly. A patient once confided that he felt troubled about engaging in self-pleasure 3 to 4 times weekly, despite enjoying a fulfilling marriage. After examining the research together, he recognized it as a wellness practice rather than any reflection on his relationship quality. His mindset transformed from self-reproach to viewing this as proactive health stewardship. Drop a comment below. Did the frequency that provides optimal benefits surprise you? Point 2. The ideal rhythm. Most gentlemen lack any framework for understanding what constitutes healthy or standard frequency. The scientific literature demonstrates that 21 or more climaxes monthly delivers the strongest protective advantages. That translates to roughly 5 occasions weekly. Some weeks may involve more activity, others less, but maintaining that average appears ideal for health optimization. This total encompasses all forms of climax: partnered intimacy, solo stimulation, and even spontaneous nocturnal releases. The cumulative total determines the benefit. For men past 50, especially those without consistent partners, self-pleasure evolves into a crucial wellness maintenance practice. Data reveals that self-stimulation rates remain nearly identical between men in committed relationships and those who are unpartnered. This isn't about substituting solo activity for partner connection. It's about preserving prostate wellness regardless of relationship circumstances. One critical clarification: exceeding this threshold doesn't necessarily amplify benefits. The protective advantages plateau around 21 monthly occurrences. Substantially exceeding that number provides no additional protection and might potentially create other complications we'll address shortly. A patient once confided that he felt troubled about engaging in self-pleasure 3 to 4 times weekly, despite enjoying a fulfilling marriage. After examining the research together, he recognized it as a wellness practice rather than any reflection on his relationship quality. His mindset transformed from self-reproach to viewing this as proactive health stewardship. Drop a comment below. Did the frequency that provides optimal benefits surprise you? Point 3. The critical errors to sidestep. Not every approach to self-stimulation yields equal results, particularly after 50. Certain mistakes can generate genuine problems. First, insufficient lubrication. As you accumulate years, your skin grows thinner and loses elasticity. Dry friction generates microscopic tissue tears, resulting in irritation, scar formation, and progressive sensitivity loss over time. Always utilize quality water-based or silicone-based lubricant. This represents a necessity, not a suggestion, after 50. Second, overly forceful grip. Some men notice diminished sensitivity with aging and compensate by applying greater pressure. This creates a destructive pattern. Increased pressure inflicts more tissue damage, which further reduces sensitivity, prompting even more forceful gripping. Employ a gentler touch and emphasize varied stimulation patterns rather than intense compression. Third, over-reliance on explicit visual content. While occasional viewing represents normal behavior, excessive consumption can modify your brain's dopamine signaling pathways. Some men discover they cannot achieve arousal or climax without progressively more extreme material. This represents a neurological phenomenon, not a character flaw, and it can disrupt genuine intimate partnerships. Fourth, dismissing warning signals. Pain during or after self-pleasure, burning sensations during urination, blood appearing in semen, or ejaculation difficulties are never normal. These symptoms may indicate prostatitis, urinary system complications, or other conditions demanding medical assessment. Never ignore them. Fifth, rushing the experience. Past 50, your body responds with different timing. Hurrying can produce incomplete ejaculation, which fails to deliver the full prostate clearing advantages. Allocate sufficient time and permit complete, satisfying climax. I treated a patient who developed chronic prostatitis from forceful self-stimulation without adequate lubrication. His symptoms encompassed pelvic discomfort, urination difficulties, and painful ejaculation. After adjusting his technique and implementing proper lubrication, his symptoms completely resolved within 6 weeks. Methodology matters equally as much as frequency. Point 4. The psychological wellness advantages. The benefits extend well beyond physical health dimensions. Self-pleasure triggers the release of multiple neurochemicals that profoundly influence your mental state. Dopamine delivers pleasure sensations and motivational drive. Oxytocin promotes relaxation and emotional connection. Serotonin elevates mood. Endorphins function as your body's natural pain management system. Prolactin, released during climax, possesses documented neuroprotective characteristics. It helps shield brain tissue from stress-induced damage. For men past 50, navigating work pressures, retirement adjustments, health anxieties, or relationship transformations, self-pleasure provides natural stress mitigation without pharmaceutical interventions or adverse effects. Scientific research demonstrates that sexual expression, including solo activity, correlates with superior sleep quality. The relaxation response following climax naturally prepares your physiology for rest. I worked with a patient battling chronic anxiety and sleep disruption who hesitated to begin prescription sleep medications. We discussed incorporating self-pleasure into his evening routine. Within 3 weeks, he reported dramatically improved sleep quality and decreased anxiety levels without any pharmaceutical intervention. Your psychological wellness benefits equally to your prostate health. Stay with me, the remaining benefits carry equal importance. Point 5. Maintaining erectile capability. Here's something numerous men fail to recognize. Consistent climax actually helps preserve erectile function through the aging process. Conceptualize it as cardiovascular exercise for your intimate physiology. Achieving erections regularly promotes blood circulation to penile tissue, maintains vascular elasticity, prevents tissue degradation, and keeps the erectile mechanism responsive. Men who eliminate all sexual expression often experience progressive erectile dysfunction. Without regular blood circulation, the tissue begins deteriorating. This truly represents a situation where you either use it or lose it. Consistent self-pleasure maintains the physiological pathways essential for healthy erectile capability even during partner absence. I encountered a patient whose wife faced serious health challenges, preventing intimacy for over 12 months. He ceased all sexual activity out of consideration for her circumstances. When conditions eventually improved, he couldn't achieve adequate erections. We focused on gradually reintroducing self-pleasure to restore circulation and function. After 4 months, his erectile capacity substantially improved. Preserving function demands regular engagement. Point 6. Confronting guilt and embarrassment. This proves especially important for men raised within religious or culturally conservative contexts. Numerous men experience what psychologists term masturbatory guilt, a psychological tension between behavior and internalized moral frameworks. From a strictly medical perspective, I can state definitively, self-pleasure represents normal, healthy behavior with documented wellness benefits, particularly for men past 50. Zero scientific evidence exists of physical or psychological harm when practiced reasonably and safely. If your religious or cultural background creates internal conflict surrounding this, that's something worth examining with a counselor or spiritual advisor, but the medical science remains unambiguous. One patient shared with me, I devoted 50 years to feeling ashamed every single time I engaged in self-pleasure. Learning the actual scientific facts liberated me from decades of pointless guilt. I only wish someone had shared this information 30 years earlier. You're not committing any wrongdoing. You're maintaining your wellness. Point 7. When professional intervention becomes necessary. While self-pleasure represents healthy behavior, certain circumstances warrant professional attention. First, if it disrupts daily functioning, if you're engaging so frequently that it impacts work performance, relationships, or daily responsibilities, that signals compulsive behavior requiring therapeutic intervention. Second, if you cannot cease despite desiring to. Feeling unable to control sexual behavior is classified as compulsive sexual behavior disorder and requires specialized treatment. Third, if you experience persistent physical complications, ongoing pain, bleeding, severe skin irritation, or inability to ejaculate, all demand urological evaluation. Fourth, if it's completely replacing partnered intimacy. If you're consistently avoiding intimate connection with your partner because self-pleasure proves easier or more gratifying, that represents a relationship concern worth addressing with a couples therapist. The vast majority of men fall nowhere near these categories, but if any describe your situation, pursuing appropriate assistance is important and nothing to feel embarrassed about. Let me provide you with a complete framework for optimal practices beyond 50. Regarding frequency, target approximately 20 to 21 climaxes monthly, roughly 5 weekly. This encompasses both partnered intimacy and solo activity. The cumulative count matters for prostate protection. Regarding technique, always employ adequate lubrication. Water-based or silicone-based products perform well. Protect your tissue from friction damage. Regarding pace, allow sufficient time. Avoid rushing. Complete, unhurried climax delivers maximum wellness advantages. Regarding balance, if you're in a relationship, maintain variety between partnered intimacy and self-pleasure. Both offer distinct benefits. Regarding explicit content, if you opt to use it, do so mindfully and occasionally rather than habitually. Remain aware of potential dependency formation. Regarding your body, listen to physical feedback. Any pain, discomfort, or functional changes should prompt medical consultation. Regarding psychology, release any guilt or shame. You're engaged in scientifically validated health maintenance. Follow this framework and you're optimizing wellness benefits while avoiding potential complications. I worked with one couple who had struggled because the husband engaged in self-pleasure several times weekly and the wife felt rejected. After discussing the health benefits openly, including her in the dialogue, and establishing that this wasn't replacing their intimacy but complementing it, their relationship improved dramatically. Understanding and communication resolved what had been a significant source of tension. Gentlemen, allow me to synthesize everything for you. Self-pleasure after 50 is not something deserving embarrassment, confusion, or shame. It represents normal, healthy behavior with substantial, scientifically documented wellness advantages. The research proves clear and compelling. Consistent climax, approximately 20 to 21 times monthly, significantly diminishes prostate cancer risk, supports erectile capability, delivers psychological wellness benefits, reduces stress, and maintains your sexual system functioning optimally. Your age makes this more critical, not less relevant. Prostate wellness becomes increasingly vital after 50, and you possess a simple, natural instrument to protect it. Stop permitting outdated shame, misinformation, or embarrassment to guide your decisions. Start allowing scientific evidence and health data to direct you instead. If you extract one insight from this presentation, let it be this: you hold the power to significantly influence your prostate wellness through consistent climax. Utilize that knowledge. If this information proved valuable, please hit that like button immediately. Comment below and share what surprised you most about this research. Did this transform your perspective? And subscribe for additional evidence-based wellness guidance on topics other physicians don't address openly. I'm Dr. Rina Shimizu. Your intimate wellness matters at every stage of life, and you deserve honest, scientific information to make informed choices. Take care of your prostate, take care of your comprehensive wellness, and live with confidence knowing you're doing what's optimal for your body. Thanks for watching.